Greetings to all learners. Myself Sharda Devre. Welcome you all to the lecture 24 Case Study-VII Indian Medicinal and Aromatic Plants Derived Formulations for Arthritis under the Week 5 Safety, Efficacy and Toxicity of Traditional Plant Drugs. Arthritis is the disorder that relates to the joints and it involves the joint pain, stiffness, swelling, redness, and it affects to the motion of the various joints too. There are more than different types of the 100 types of the arthritis, and out of these most common are the osteoarthritis, rheumatoid arthritis, gout, psoriatic arthritis and juvenile arthritis. There are number of reasons for the arthritis, either genetic factors, hormones like testosterone, estrogen, menopause, or age, smoking, stress, obesity, gut, flora, diet, and early life factors that are found to be responsible for the different type of the arthritis. And at a molecular levels, there are the various interleukin factors. You can see here that interleukin 15, 18, interleukin 10, 6, 1. So there are so many interleukins that are involved along with the cluster of identification. These are the actually identification system that able to identify the antigens present on the leukocytes. So CD11 or CD20, then CD3. These molecules are found to be involved in the uh, symptoms of the various types of the arthritis. Along with that, there are the various factors, that is a tumor necrosis factors or NK cells, along with this granulocyte macrophage colony stimulating factor, which is actually a cytokinin. So cytokines are also involved in the arthritis symptoms or reason or one of the cause of the arthritis. So according to that, these are the targets as they are involved in the arthritis progress. So that's what interleukin inhibitors or CD inhibitors or these granulocyte macrophage colony stimulating factor inhibitors. So various these type of the drugs are utilized, synthetic allopathic drugs are utilized to treat the arthritis, but as such these are not considered as a treatment for the any type of the arthritis. They not able to cure it, just they are giving the relief from the certain type of the symptoms, either inflammation or redness or joint pain, but there is a no complete cure for the arthritis from these so many different type of the synthetic drugs. So naturally, as per Ayurveda, Siddha, Unani, homeopathy system and various other traditional texts, the most commonly used medicinal plants for the arthritis is the Daru Halad, which is called as a Berberis aristata, belonging to family Berberidaceae, which contains the alkaloid berberin and which is found to inhibit these factors, that is a tumor necrosis factors, interleukin or uh, uh, cox, which is involved in the inflammatory process of the body. So berberin is the chemical compound which is found in the daru halad, are found to be potent anti-inflammatory agent. Then nirgudi, which is vitex nirgundo family Verbenaceae, which contains the flavonoids, various types of the flavonoids like the luteolin and luteolin derivatives and isoorientine. Then iridoid glycosides, along with it contains certain type of the sterols also, stigmasterol and citosterol. They all together are found to be very good anti-arthritic and anti-inflammatory, and they are supposed to target more than 2 or 3 of these factors which are found to progress the arthritis. Then white willow, which is Salix alba, Salicaceae family, which contains the glycoside salicin, and this is also found to give the relief from the pain, which is very good analgesic as well as antipyretic in nature. The next it is the ashwagandha, which is the Vidania somnifera family Solanaceae, which contains the various types of the steroidal alkaloids, vidanolides, and various types of other pure alkaloids also, and they together mimic the actions of the various steroidal compounds, and hence they able to affect to the interleukins as well as the cox, and then tumor necrosis factors and the NFKB, and thus they gives the relief from the arthritis. Next plant, that is a curcuma, which is curcuma longa, belonging to family Zinziberaceae and contains the phenolic compound curcumin. This is also found to be involved in the various factors that are causing the joint pain or swelling or stiffness of the joints, and that is through the effect on the various types of the factors, molecular factors that are involved. Next, it is the salai gugul Boswellia serrata berseraceae, which contains the triterpenoid boswellic acid. This is the common drug that is mostly found in the various traditional formulations for the inflammations or for the arthritis treatment. Next, it is the Artemisia, which is the Artemisia judaica asteraceae family. Triterpenoid taraxerol is the main chemical constituent, which is found to be responsible for the anti-arthritic action. Then licorice, which is called as a gestamad, that is Glycyrrhiza glabra leguminosae family, which contains the triterpenoid saponins along with the various types of the flavonoids, and they also inhibits the COX pathway, which is involved in the inflammation process and further in the rheumatoid arthritis. So altogether, these different types of the medicinal plants are found to affect to the various targets, molecular targets that are causing the increase in the arthritics related symptoms of the joint pain, and thus they give the relief, they prevent the arthritis, or if arthritis is there, then its further progress is delayed by the consumption of these medicinal plants and derived. Next plant, it is a black cumin, which is a Nigella sativa family Ranunculaceae, and it contains the chemical compound thymoquinone, which is found to be responsible in regulation of the interleukin, tumor necrosis factor, and NFKB, that is a nuclear factor kappa B, which is involved in the immunity of the human beings. Then next, it is a ginger, Gingiber officinale, Gingiberaceae, which we commonly consume as a spice, and it is found to be involved in the COX-1 and COX-2, that is a cyclooxygenase 1 and cyclooxygenase 2 pathway inhibition, that is causing the reduction in the inflammation as well as the joint pain. And the chemical compounds that are present in the ginger are the resinous compound, that is a gingerol and shagol. Then next, it is the very popular anti-inflammatory drug, that is a gokru, which is a Tribulus terrestris family Zygophyllaceae, and it is also found to be, its chemical constituents are found to be involved in the nitric oxide synthase 2 down regulations, then interleukin 6, then tumor necrosis factor, cyclooxygenase 2, and various other type of the molecular targets that are responsible for the progress of the arthritis. Next, it is the cannabis, Cannabis sativum cannabaceae, which is a very regulated type of the drug due to its addiction, but its chemical constituents, that is cannabidiol, are found to exhibit the potent anti-inflammatory and anti-arthritic activity due to the effect on the various immunity factors like the interleukin, cyclooxygenase, or the tumor necrosis factors, then cluster of differentiation, that is a CD cells, and etc. Then Kosht, that is a Sarsaparilla asteraceae, which is very popular Ayurvedic plant, and it contains the various types of the flavonoid, tannins, and phenolic compounds that are also found to cure the arthritis or helpful in the cure of the symptoms of the arthritis. Next, it is a long pepper, Piper longum pipraceae, which is responsible for change in the aroma as well as flavor of the formulation, but its piperine compound is also found to be anti-inflammatory, anti-arthritic in nature due to the increase in the viability of the other compounds. Then pomegranate, which is a popular fruit, and that is a Punica granatum family Lythraceae, which contains various phenolic compounds, and that are also found to involved as an anti-inflammatory, anti-arthritic. And next, it is a pineapple, Annona commosus family Bromeliaceae, which contains the enzyme bromelain, and which is a soft tissue anti-inflammatory, and thus for the microvascular injuries in the arthritis are cured with the consumption of the pineapple. There are various Ayurvedic and Unani formulations for the arthritis or joint pain inflammation are mentioned, and that are most commonly Yogaraja Gugulu, Vatari Gugulu, Abha Gugulu, then Punar Navadi Kashyam, Gugulu Tiktam Kashyam, Dashanga Ghana, and Unani also there is the Majun Suranjan, Safuf Suranjan, Habbe Suranjan, Habbe Asgandh, habbe manthan. So these are the formulations. They contain these type of the different combinations of the mentioned medicinal plants, either in the same proportion or few of these drugs are more like that. Suppose habbe ashwagandha, then ashwagandha is more. In case of habbe kuchla, then naksomika is more. So like that gugulu, then gugulu is the one of the major ingredient. So like that there are various formulations that are mentioned for the treatment of the arthritis in Ayurveda, Siddha, Unani and homeopathy. So in this lecture 24, we have studied the various Indian medicinal and aromatic plants as well as their derived formulations, and how the arthritis is complex type of the disease, involves so many immunity factors, and there are different type of the symptoms of the arthritis. Different types of the arthritis are there, and they are affecting to the movement of the human being, and that's why it should be treated with the most promising natural drugs. Thank you.